Shalom and welcome to Sinai Seminars. We're going to do 12 tips today. If you're a patient of Sinai Dental, you will be aware that we always place a strong emphasis on prevention, and more prevention. But today I'd like to share a few preventive tips and reminders, not on the usual flossing, brushing, tongue scraping, mouth washing, and avoidance of sugar that I normally go on about, but on community and personal prevention habits as we continue together, as we partner together as a community force to slow down and ultimately eliminate the spread of COVID-19 virus. All 12 of the tips I'm going to share are based on preventive principles that we already know about. We're just reapplying them. The sharing will simply highlight awareness of the regime, deliberateness of action, repetition until it becomes a habit. So let's start off with the first 6 tips of the 12. They're divided into 6 because the first 6 of them really pertain to things we can do outside, on the outside, and you'll see what I mean when I start. So let's get started. Tip number 1. First of all, do not panic or fear. We're all in it together, and together we're going to defeat this virus. If there are sources of panic or fear around you that's making you very fearful, disconnect from them. Fear causes confusion, it fogs up the mind, and we need our minds right now to think clearly, to direct our actions. By the way, fear also causes a reaction inside of our bodies that decrease our internal immune system, ignites that fight and flight thing. We need our immune systems to be strong at this time. So let's eliminate fear. Okay, tip number 2, gather up all up-to-date mandatory preventive instructions that AHS has provided. Once we've gathered that up, post it where we can see it and remember it. And just remember, this is a regime that we cannot break. We can't break these rules. These are things we need to do. They're mandatory preventive instructions that we need to do to stop the spread of this virus. So let's talk about what they are. Washing the hands. So washing our hands and washing them thoroughly for over 20 seconds, making sure that under the nails, everywhere on the dorsal and this part, and on the, if you look at my hands, you see how dry they are because we're constantly washing them. I won't show them to you again because they're not very pretty. So washing the hands, keeping the hands away from the entry zone, which is the face, and the 4 portals of what I call the 4 portals of the entry zone on the face, and those are the eyes, the nose, the ears, and the mouth. Another thing is sneezing into the sleeve. If we have to, social distancing, protecting others if we're symptomatic, even if we're not symptomatic, protecting others, not touching things in public places if we don't have to, and then if we do, wash our hands again. So it all comes back to washing the hands. And these are rules that are mandatory, and we cannot break these. We have to adhere to these.